Hi, I'm Jenna Sicilian, and this is my informative speech on the complications of type 2 diabetes. This is my outline. Imagine being confined to a chair for 4 hours a day, 4 days a week, while a needle in your arm extracts blood from your body, cleans it in a loud machine, then returns it back to your body. This is called renal dialysis, and what occurs when the kidneys shut down and your body needs help cleaning your blood. Kidney failure is just one of the many complications that can result when type 2 diabetes is not maintained. So what is type 2 diabetes? Type 2 diabetes, also called adult onset diabetes, is a form of diabetes that is diagnosed later on in life and is caused when the body stops producing insulin. If left untreated, serious health issues such as kidney failure, heart disease, blindness, gangrene, diabetic neuropathy, and stroke can result. So what makes type 2 diabetes different from type 1 diabetes? Well, according to WebMD, in type 1 diabetes, the immune system attacks the insulin-producing beta cells in the pancreas and destroys them. The pancreas then produces little or no insulin. A person who has type 1 diabetes must take insulin daily to live. In type 2 diabetes, the pancreas usually is producing enough insulin, but the body cannot use the insulin effectively, which produces a condition called insulin resistance. After several years, insulin production decreases. If left untreated, type 2 diabetes can have life-threatening complications such as kidney failure, heart disease, blindness, gangrene, diabetic neuropathy, and stroke. Kidney failure is when the kidneys do not filter blood anymore. Too much glucose in the blood for a long time can damage many parts of the body, such as the heart, blood vessels, eyes, and kidneys. According to WebMD, kidney failure can be measured by how well the kidneys are able to filter waste from the blood. This is called glomerular filtration rate, or the GFR. Kidney failure usually occurs when the GFR falls to below 15% of what is expected in a person with normal kidney function. My grandmother was diagnosed with type 2 diabetes at the age of 50, and by 70 her kidneys had completely shut down and she had to be placed on renal dialysis to live. She said it was a very painful procedure and her body eventually started to reject it. In March 2009, she passed away from disease when she decided to take herself off of it. Heart disease is the most prevalent complication of diabetes. Most of the cardiovascular complications related to diabetes have to do with the way the heart pumps blood through the body. According to WebMD, coronary artery disease is caused by the buildup of plaque on the inside of the coronary arteries, the blood vessels that supply oxygen-rich blood to the heart muscle. Plaque is made up of excess cholesterol, calcium, and other substances that float in blood and over time builds up on the inside walls of the coronary arteries and other arteries. Diabetes can change the chemical makeup of some of the substances found in the blood, and this can cause blood vessels to narrow or clog up completely. This is called atherosclerosis, or hardening of the arteries, and diabetes seems to speed this up. Blindness is another complication. Diabetic retinopathy is a disease of the retina, the thin tissue that lines the back of the eye. Diabetic retinopathy affects people with diabetes. It is the leading cause of blindness in American adults, and it is caused by changes in the blood vessels of the retina. The diabetic eye disease weakens the small blood vessels in the retina. Retinal blood vessels can break down, leak, or become blocked, affecting and impairing vision over time. In some people with diabetic retinopathy, damage to the eye can occur when abnormal new blood vessels grow on the surface of the retina. The condition is related to high blood sugar levels, which interfere with oxygen delivery to the cells in the retina. Gangrene is a condition that involves the death and decay of tissue, usually in the extremities. There are 3 types of gangrene: dry, wet, or gas gangrene. Dry gangrene is the one that most often affects people with diabetes. Reduced blood flow or lack of circulation resulting from diabetes, cardiovascular problems, and smoking are the most common causes. Poor blood flow in the arms and legs is called peripheral vascular disease. Peripheral vascular disease is a circulation disorder that affects blood vessels away from the heart. People with diabetes are at risk for developing ulcers or gangrene. Toes, feet, lower limbs, and sometimes fingers can all become vulnerable to the complications that may cause gangrene. Symptoms include numbness in the affected part, and they will also be cold to the touch. With diabetic neuropathy, This is a damaging of the nerves over time. Some people with nerve damage have no symptoms. Others may have symptoms such as pain, tingling, or numbness, which is a loss of feeling, in the hands, arms, feet, and legs. The causes are probably different for different types of diabetic neuropathy. Researchers are studying how prolonged exposure to high blood glucose causes nerve damage. Nerve damage is likely due to a combination of factors, such as metabolic factors, high blood glucose, long duration of diabetes, abnormal blood fat levels, and possibly low levels of insulin. Also, neurovascular factors leading to damage to the blood vessels that carry oxygen and nutrients to nerves. Stroke and heart disease account for 65% of deaths from diabetes. A stroke, sometimes called a brain attack, occurs when blood supply to part of your brain is interrupted and brain tissue is damaged. The most common cause is a blocked blood vessel. Stroke can cause physical problems such as paralysis, problems with thinking or speaking, and emotional problems. Just having diabetes puts you at risk, but your risk is even greater if you have high blood pressure, you have abnormal blood cholesterol levels, you smoke, or you've already had a stroke or a mini stroke. A person with diabetes can lower their risk by keeping their blood glucose at a normal level, maintaining their blood pressure, and keeping their cholesterol at a normal level with meal planning, physical activity, and medication. Quitting smoking is definitely a major factor that can stop a stroke. When people with diabetes have a stroke, they often manage worse than individuals without diabetes. When the oxygen supply is cut off, other arteries can usually deliver oxygen by bypassing the blockage. In people with diabetes, however, many of the bypass arteries are also affected by atherosclerosis, which I mentioned before is a disease in which plaque builds up on the insides of your arteries, impairing blood flow to the brain. If taken care of properly, people with diabetes can live normal, healthy lives. This can be done by maintaining weight, meaning they can exercise, running, walking, any kind of cardiovascular activity to keep the heart rate up. They can eat a healthy, balanced diet, including fruits and vegetables, whole grain carbs, and they can limit simple and processed sugars because this spikes the blood sugar to unhealthy glucose levels. They can also practice healthy habits, such as not smoking, because smoking affects the circulation system in a negative way. It restricts blood from properly flowing, and as I mentioned before, this can cause such complications as gangrene. They can also avoid alcohol, which is made of pure sugar, and also spikes the blood sugar levels to an unhealthy rate. They can also regulate their blood sugar by regularly testing blood sugar to make sure it is not too low or too high. They can give themselves insulin injections daily, and they can research or consider taking diabetic drugs that can help manage their diabetes and blood sugar. My grandmother chose to go against her doctor's warnings and continued to eat foods high in sugar and fat, didn't watch her weight or exercise, and did not keep her blood sugar in check. Because she ignored her disease, she experienced many of the complications that resulted, such as diabetic retinopathy, diabetic neuropathy, and kidney failure, which ultimately led to her death. This shows that if taken care of properly, people with diabetes can live normal lives and can avoid these complications completely. Thank you.